Lily, wave.
Hello. One of the most important roles in the hospital, besides being a physician, is nursing, specifically ICU nursing. When my grandfather, whom I called Poppy, became seriously ill, I witnessed firsthand how nurses could not only provide for him, but also my family during one of the hardest times. This inspired me to continue my education in nursing, but specifically ICU nursing. ICU nurses deal with some of the sickest patients in the hospital and play a critical role in saving lives. As a nursing student, I have research, education, responsibilities, and opportunities associated with the ICU nurse. Today, I will discuss with you the required education to become an ICU nurse, the responsibilities that the ICU nurses perform daily, and also the rewards of earning the career of becoming an ICU nurse. To become an ICU nurse, not only do you have to take the required nursing and associated program with the field, but you also have to be able to pass the NCLEX to become a licensed registered nurse. Many ICU nurses gain bedside experience and pursue specialized trainings and certifications as a clinical care registered nurse. Now that we understand the educational requirements, let's examine the daily responsibilities of the ICU nurses. ICU nurses don't just provide to the families, but they also provide to critically ill sick patients. As an ICU nurse, you're constantly monitoring patients, getting vital signs, watching ventilators, dealing with life support equipment, and so much more. ICU nurses administer medications, perform assessments, respond quickly to emergencies, whether it's bedside, on the floor, going to the ER, going to other places throughout the hospital. ICU nurses also communicate with respiratory therapists, regular therapists, physicians, family members to ensure quality care for the patient. Although ICU nursing can be challenging, it also gives you rewards and opportunities. ICU nursing offers significant personal and professional rewards. ICU nurses make a different impact on patients, families, nurses, everybody. ICU nurses develop advanced clinical skills and critical thinking abilities. They also provide opportunities for career advancements such as roles in flight nursing, nurse practitioner, nurse education, and nurse managers. After learning about the education, responsibilities, and the rewards of ICU nursing, we can better appreciate the importance of the profession. Today I've discussed the education required to be an ICU nurse, the responsibilities to become an ICU nurse while caring for critically ill patients, and also along bedside with family members in some of the hardest times. I've also discussed the many rewards and opportunities available in working in critical care nursing. In conclusion to all this, ICU nurses are highly skilled professionals who combine medical knowledge, quick decision making, and compassion for patients during their most vulnerable time. Although the job is demanding, the opportunity is to save lives, support families, make ICU nursing one of the rewarding careers in healthcare. Thank you.